welcome to my channel. My name is Jazzy RN. I am a remote utilization review nurse. I've worked remotely for over 9 years, and I have worked for 3 different companies, and the goal of my channel is to help nurses pivot from the bedside to remote work. This first company is called Global Health, and they are hiring a fully remote case manager RN. This is a full-time day shift position, and the requirements are an active registered nurse license in the state of Oklahoma that is required. Active multi-state RN license is preferred, and previous experience in managed care or utilization management is preferred. This is not required, it's a preference. The next job is with the company Machinify, and they're looking for a medical review nurse, and this is for readmissions. Now the hiring range is $72,000 to $78,000 and may be adjusted to reflect applicant experience. We're going to go straight to the responsibilities. The qualifications. So you must be an unrestricted RN license. You must have an active unrestricted RN license in good standing. You must not be currently sanctioned or excluded from the Medicare program by the OIG. A minimum of 5 years diversified nursing experience providing direct care in an inpatient setting. 1 or more years experience performing medical reviews. 1 or more years experience in healthcare claims that demonstrates expertise in ICD-9 or ICD-10 coding, HCPS or CPT coding, DRG and medical billing experience for an insurance company or hospital is required. Other qualifications may be required and will be discussed during an interview. And this is a remote role with Machinify. The next position is with Blue Cross Blue Shield. I believe this is Blue Cross Blue Shield of Alabama. And they are looking for a ACHN RN care manager. Actually, I'm going to skip this job. This one is actually not fully remote. We're going to go to this one, which is a care coordinator, which is Baby Yourself. This is a very interesting title. It was posted on March 25th. This is a full-time job. The requirements or qualifications is a bachelor's degree or upon hire, commit to actively pursue a degree, active license in good standing as a registered nurse, State of Alabama licensure as a registered nurse, or multi-state licensure as a registered nurse, compact. Minimum of 3 years of clinical experience in medical, surgical health care fields, a psychiatric and or obstetrical setting, effective verbal and written communication skills with providers, subscribers, and group representatives, experience analyzing and making informed decisions in an autonomous setting, experience in physician interpreting and communicating information orally and written with all levels of staff, internal and external, experience in a position requiring independent decision-making skills, willingness to work a flexible schedule in order to provide telephone coverage. This one has a willingness of travel up to 10% of the time as needed. Now this job did not state exactly where you're traveling to. Experience in a position using negotiation skills preferred. Experience in a position presenting information in formal and informal settings is preferred. IBCLC certification is strongly preferred. 4 or more years of experience in women's health, specifically in obstetrics, labor and delivery, and prenatal care. Specialties is preferred. Certified case manager is preferred. And experience in women's health, including but not limited to routine gynecological care, fertility counseling and treatments, comprehensive prenatal and postpartum care, labor and delivery support, and providing education for maternal and infant health, strongly preferred. The next company, this is with Health Help, and they are hiring a concurrent inpatient review nurse. It is a full-time role. The pay rate starts at $75,000 per year. And for the qualifications or requirements, you must have be an RN graduate from an accredited school of nursing. A BSN is preferred. current, active, unrestricted, or unlicensed in the state or territory of the U.S. Now, right here where it says U.S. RN equivalent, I've only seen U.S. RN job postings whenever they are hiring nurses who live in the Philippines to work for American companies. So this lets me know that they actually hire nurses who have obtained their nurse degree or education outside the United States. 2 years of experience in an acute care setting is required. 2 years of inpatient clinical nursing, utilization management, or case management experience is preferred. Now, this is not required, it's preferred. Experience with interqual or similar evidence-based clinical decision support criteria is preferred. That is not required, it's preferred. Willingness to complete and maintain interqual certification and ongoing competency requirements. And what this is once a year, you will have to take an IRR test, and this basically just confirms your competency using interqual. And it's an open book test, and if you actually fail one of the tests the first time around, you can retake it within maybe 2 or 3 months. Familiarity with inpatient level of care, observation versus inpatient status determinations, and transitional care planning preferred. I'm going to also include more information about what is inpatient review nursing and how it relates to bedside nursing. Now, working knowledge of medical necessity criteria, level of care determination standards, and payer-specific utilization review requirements, knowledge of insurance terminology, experience working with state and federal regulatory and compliance standards preferred. They will teach you all these regulations and standards. Every state is like its own country. So if you actually have experience in one state, that experience doesn't automatically give you all the knowledge you need for working in a different state. Proficient technical skills in Microsoft Office required. Make sure your resume does have Microsoft Office as one of the platforms you are familiar with. Good organizational and time management skills, excellent written and verbal communication skills, ability to utilize critical thinking skills, and highly motivated self-starter who can work efficiently and independently or as a team member. And the base salary for this position is $75,000 annually. So it looks like this job is not an hourly job, but it is a salary job. This next position is a team lead, registered nurse, expert medical opinion, and this company is Transparent. It is a remote job. The applicants will work from 9 a.m. to 6 p.m. Central Standard Time. And applicants with medical surgical experience, post-anesthesia care unit, and pediatric experience are encouraged to apply. And the hiring manager is willing to train applicants who may not have musculoskeletal experience. So straight to the requirements, and they require you to have a BSN or RN with a bachelor's degree with a minimum of 5 years of clinical experience, or associate's degree with a minimum of 7 years of clinical experience. They want you to have 1 year telephonic nursing experience, a current and valid RN license, experience leading a team of nurses. So it looks like this is a leadership role. Proficiency in navigating technologies including EMR, electronic medical records. Make sure you do have the electronic medical records you are familiar with on your resume. That's Epic, Cerner, Meditech, Protouch, etc. Include all your EMR proficiencies on your resume. And you also want to push and promote your tech savviness. So they also include professional technology platforms while multitasking effectively, listening, typing, and member interaction. Flexibility and adaptability in a dynamic healthcare environment with strong teamwork, empathetic listener and communicator, and commitment to continuing education. And these nice to haves are 2 to 3 years of direct patient care or case management, a certified case manager certification, our commitment to obtain within 1 year of hire, experience in one or more of the following: utilization management, triage, managed care, and discharge planning. And this is nice to have, but you don't have to have it. and familiarity with health plans, population health, and value-based healthcare programs, and an RN license with a compact licensure. And this is a remote position, and the pay rate is starting at $100,000 per year to $110,000 per year. This is with TransCarent. The next company is Interpros, and they are hiring for a utilization management nurse, RN. This is tri-state for Pennsylvania, Delaware, and New Jersey. It is a full-time position, and you will work every other weekend, and you must reside in Pennsylvania, Delaware, and New Jersey. They want you to have an active Pennsylvania RN license or a nurse licensure compact, including Pennsylvania. And the qualifications, of course, active Pennsylvania RN licensure, and a BSN is preferred. They want you to have a minimum of 3 years of medical surgical experience. Experience in acute hospital utilization management or intercrawl is preferred. This is not required, as it is preferred. And then knowledge and skills: exceptional communication, problem solving and interpersonal skills, strong organizational planning and time management abilities, ability to prioritize, take initiative, and achieve results in a fast-paced environment, team-oriented with collaborative and motivational skills, adaptable to open to new ideas, and proactive in identifying opportunities, respectful and inclusive of diverse colleagues and patient populations, proficient with Microsoft Word, Outlook, Excel, SharePoint, Adobe programs. Now, Outlook and Excel and Word are used as a utilization management nurse, but Excel is not used as much. You're not actually doing pivot tables or anything that's more on an expert level regarding Excel. SharePoint is an internal intranet site on how you navigate when you're looking for specific information regarding, let's say you're reviewing authorization and you want to make sure you're doing the authorization correctly. There are ways to navigate the intranet, and it's also called SharePoint, on how to do your job. Adobe programs, the only Adobe programs we actually use is whenever we're opening authorizations, and the authorization has the member's clinicals or their chart attached to the authorization. Sometimes when you open that attachment, it's open as an Adobe program. And able to learn new systems as technology advances, and knowledge of current trends in medical practice. Now, I want to show you something about the utilization review and how it relates to bedside nursing. So as you see here, a bedside nurse has a patient, an insurance nurse has a member. So let's say the bedside nurse, his or her patient comes in for bowel obstruction, and that's a diagnosis. The same for the insurance nurse. So on the bedside nursing side, let's say a radiologic technologist performs an abdominal or pelvic x-ray, and the results are read by the radiologist, and it is positive for bowel obstruction. The doctor orders the patient to have an NG tube to suction, IV fluids at 100 cc's an hour, and NPO. Now, I happen to have the criteria for bowel obstruction already memorized. This is using interqual, and in order for this member on the insurance nurse side to meet medical necessity, and for the insurance nurse to approve this authorization, this member must have an imaging positive for bowel obstruction. Doesn't matter where the obstruction is in the bowel. The member must also be NPO. The member must have an NG tube to suction, and continuous IV fluids. Now the insurance nurse can approve the authorization. Now, where does this clinical come from that the insurance nurse is reviewing? It is the charting that you are doing on the bedside. Whatever charting you're doing, that the CNA is doing, the doctor is doing, the radiologist, all that charting information is transferred. We actually request fax clinicals, which is your charting, to be sent to the insurance company. That way the nurse can review it for medical necessity. And then the last job is with Hone, and they are looking for a RN clinical navigator. And the requirements for this job is for the nurse to be a licensed RN. You must hold a compact state license, or live in an eligible state. Ability to multitask, prioritize, and adhere to deadlines while maintaining attention to detail and quality. Comfortable in a fast-paced, frequently changing environment, creative problem-solving skills with a results-driven mindset, can quickly learn new technology systems and communication tools. Now this right here, technology systems, sometimes they actually get rid of old programs and replace with new ones. So let's say whatever job you worked at was using an old electronic medical records and decided to upgrade to Cerner or Epic. Then the same thing happens on the insurance side. And then communication tools would include the Microsoft Teams whenever you're emailing, messaging your coworkers, as well as Microsoft Outlook and the internal phone. Some companies or insurance companies use WebEx. So if you're making and receiving phone calls, you also can get phone calls internally through your laptop. And then the next bullet point is ability to work autonomously and collaboratively. 3+ years experience working with physicians and our patients in a healthcare setting preferred. That's basically bedside, and then ideally in a telemedicine environment. Very comfortable using common technology platforms such as Gmail, Google Docs, Google Sheets, and Google Meet. Now, I haven't used these before as an insurance nurse. We've used only Microsoft products. So instead of Google Docs, we've used Microsoft Word. Instead of Gmail, we use Outlook. Instead of Google Sheets, we use Excel. And instead of Google Meet, we use Microsoft Teams. Effective and passionate communicator, that's written and verbal, and must be a self-starter who looks for opportunities for improvement regularly. And this job has a compensation range of $65,000 to $75,000 annually.